Is unusual vaginal discharge a cervical cancer symptom? Unusual vaginal discharge can be a sign of cervical cancer, but it's not always the case. Understanding what to look for and when to see a doctor is key. Cervical cancer develops when abnormal cells grow in the cervix, which is the lower part of the uterus connecting to the vagina. As the cancer progresses, it can cause changes in vaginal discharge that differ from what's normal. In the early stages, many women have no symptoms at all. That's why regular screening tests like pap smears and HPV tests are so important for catching issues early. When the disease advances, abnormal discharge becomes more noticeable. The discharge linked to cervical cancer often looks different from normal discharge. It may be watery, thin, or have a bloody or dark appearance. Sometimes it's pink, red, or brown because it contains blood. Women might notice an increase in the amount of discharge that lasts longer than usual or doesn't follow their normal cycle. A very distinctive feature is a foul smell. This unpleasant odor can happen when cancerous tissues break down or when the tumor causes tissue death. Some women describe the smell as similar to rotting meat. The discharge may also contain tissue fragments or necrotic material. In more advanced cases, infections are common because the weakened cervix can become infected, leading to yellow-green or pus-like discharge. Sometimes, an abnormal connection called a fistula can develop, causing unpleasant-smelling fluid to leak from the vagina. It's important to remember that abnormal vaginal discharge often occurs with other symptoms. These include bleeding between periods, after sex, or after menopause. Heavier or longer periods, pelvic pain, pain during intercourse, or a feeling of pressure in the pelvis are also common signs. During a medical exam, a healthcare provider might see an abnormal lesion on the cervix, which can be flat, raised, or ulcerated, and may vary in color. To confirm diagnosis, doctors usually perform a pap smear and biopsy. While unusual discharge can be a sign of cervical cancer, many other conditions like infections, hormonal changes, or other gynecological issues can cause similar symptoms. That's why persistent or unusual changes in discharge, especially if accompanied by bleeding or pelvic pain, should always be evaluated by a healthcare professional. Regular screening is crucial because it helps detect cervical cancer early, often before symptoms appear. Advances in screening methods have greatly improved outcomes, making early detection and treatment more successful. If you notice foul-smelling, bloody, watery, or dark discharge that lasts beyond your normal cycle, or if it's accompanied by bleeding or pelvic discomfort, don't hesitate to see your healthcare provider. Early assessment and diagnosis are essential for the best possible treatment outcomes. Remember, each person's experience can be different, so personalized medical advice is always the best course of action.